Hello, my name is Cheryl Jones. I am a social work intern at the Veterans Administration in Philadelphia. Today I will be meeting with Andrew, my patient that I have seen for 4 visits, and we will be discussing his abuse of Xanax. Andrew is currently prescribed Klonopin, which is a benzodiazepine, to help with his anxiety. However, Andrew called on the phone and informed me that he had lost his relative and he could not sleep and he was fidgeting and he was having some difficulties. So Andrew decided to self-medicate by abusing Xanax that he purchased off one of his friends. Today we will be talking about that and how Andrew can get back on track so that he can remain compliant with his treatment program and stop abusing medication that may cause some conflicts with his methadone. So sit back and enjoy. Thank you. Hi, Mr. Jones. How are you today?
Good, Michelle. How you doing?
I'm doing great. So how was your weekend?
Okay, it was pretty good. It had a little hectic. I probably used a little one of those medications that I shouldn't have, so I apologize. I feel a little anxiety, a little family death, a little Xanax.
Okay, so you used Xanax over the weekend.
Yes, it helped go with my clonopin. I guess I might have did something wrong. I'm not quite sure. I was such a wreck.
Well, Mr. Jones, I'm glad that you were honest about using Xanax because you know that that's not a prescribed medication for you. You're on Klonopin to help with your anxiety. The
Mm.
Xanax is actually a little stronger, so you can have an adverse reaction to that.
Oh, is that right?
Yes, you can have an adverse reaction. And on top of that, your urine tested positive for a higher level of benzodiazepines.
Wow, is that what that means?
Yes, sir.
But I'm prescribed that, right?
You prescribe Klonopin, but at a certain dosage. So when you self-medicate, you are going against the treatment plan.
Oh.
Yeah, so we want you. You've been doing very well since you've been coming here. So this is our 4th visit, and you've been doing very well with your medication, taking your methadone on time as prescribed.
Yes,
You're
I'm
taking
pleased with
your
the clinic and everything, but just had that, I guess, that little family setback,
yes,
the death in the family.
yes.
I don't want to, jeopardize anything, but I'm satisfied with the treatment that I'm
Okay.
here.
Okay. Well, it sounds like you have a lack of some coping skills. If you are going out there buying Xanax, I don't want to minimize you using that because that's very serious.
Yeah, but it was just for that one time only,
It
though.
was just that one
And I
time.
don't mind telling you about it because I sure did. So.
Okay. Well, your levels look a little elevated, so we're gonna work. So what I'm going to do is I want to come back to that. We're going to work on some things. I'm going to give you some assignments to do over the weekend that you can bring back next week and we can work on. So tell
Okay.
me about how is your health coming along?
Well, I've been doing pretty good. I've been eating pretty good.
Okay.
Um, I hadn't taken my flu shots yet, but I'm thinking about taking my flu shots probably within the next 2, 3 weeks because it
Mhm.
started getting cold a little bit,
Mhm.
and I'm not quite sure that medication is holding me, strong enough.
Mhm.
And that's one reason why we got the extra. And maybe that wasn't a good idea. I'm not quite sure.
Okay. Well, you realize that you were aware that it wasn't a good idea. So apparently, there's something that we should do about that. So what we could do is, you can talk to the psychiatrist to see if he can reassess you for a different medication or give you something else to help you calm yourself with your anxiety. So how are
Okay.
you sleeping? Are you not sleeping well at night?
Well, I've been up and down,
Mhm.
for a course of some time now, as you
Okay.
know. And the best sleep that I have received, uh, 2.5 hours, and the best is like 4 hours at a time. Now with this
Okay.
new situation, I couldn't get no sleep at all.
Okay. Well, I mean, I really feel like yeah, that's got to be tough, not being able to sleep.
Yes.
How are you handling your? How about your post traumatic? How is that going?
Well, I'm trying to continue to practice my little meditation with the little pieces
Mhm.
of medication, but I don't like to take a whole bunch of medication
Okay.
because it hurts my stomach.
Mhm.
I can get something. I think they gave me something to take before I eat a little banana before I take that medication
Okay.
because it sort of upset my stomach a lot. So,
Yeah.
but other than that, I've been
Mhm.
doing pretty good.
Mhm. Well, I want you to work on some things. So what I came up with is um, I would like for you to write down every day when you are feeling stress and anxiety. I want you to write them down. The time you feel it, what you feel, and what causes you to feel that way. If you're feeling anxiety,
How long you want me to do that?
I want you to do it for a week. Can
1
you do
week?
it? Can you do it for a week?
But this only happened at one time, though.
Yeah, but you are having anxiety, so I want to make sure we can rule out and look at what's going on with you in your life. Because there may be some other things going on that you're not aware of.
Like what?
I don't know. That's why it's good for you if you could write them down for me. So I'm
Okay.
going to give you some documents that you can write it down every for 7 days. For
7 days?
7 days.
Well, my activity, I get up, I do my little chores, you would take my little medication. That's about it.
Okay. Well, that's fine. But still, for me to be able to help you, so I can get a little better picture,
Okay.
and we can try to see. So
I
I can
think I
talk to the
understand
special.
what you're saying.
Yeah. So if you write it down, you write your thoughts, how you feel, what's causing you to feel that way, and then I want you to rank them. What, which one make you feel the worst? And just write it on your paper that I'm going to
Hmm.
give you, and then you bring that back to me.
Okay, okay. Sounds
Okay?
like a good
You think
deal.
you could do that?
Yeah, I can write you what I probably think what made me do that. Like maybe I got in an argument with my sister.
Yeah.
She
That's
might have made me made me a little anxious. I said, okay,
Yes,
all
that's
right,
exactly what I'm
okay.
looking for.
Thank you.
Anything like that that can make you feel uncomfortable, that's what I want you to write down for me.
Okay.
The second thing I want you to do is practice some relaxation.
Oh yeah, I like that idea. I like to do a little yoga, but I ain't no yoga to do a little dance. But I can't move like this, so I
Right.
listen to some music.
Well, wonderful. That's exactly what I was going to suggest. I'm going
Mm.
to suggest that every day for 10 minutes before you go to bed, if you
Okay.
can do it. You can start off with 5 if you can't do 10, and just sit there and relax. Put some soft music on. I know you mentioned to me in the last session that you like gospel music. So maybe play
Gospel,
some
easy
gospel,
listening, yes.
easy listening.
Mm-hmm.
Sit there and just play that for 10 minutes, and then after
Mm-hmm.
that, just go to bed.
That sounds good.
Yeah, and then the third thing I'm going to do, I'm going to talk to the psychiatrist about your situation. You having so much anxiety. Once we get your your paperback next week when we go over in our individual session. Okay?
Okay.
Well, I think that's about it. So what I'm going to do is give you the document that you can use to record your anxiety on. And
Okay.
just make sure you bring it back with you next week. So I'm going to give this to you to follow. So
Okay.
just everything is outlined for you. All you have to do is write on here
Okay.
what day you were
Mm-hmm.
feeling anxious, what caused you to feel
Mm-hmm.
anxious,
Mm-hmm.
and just
Okay.
record that for me for 7 days. And then once at the end of the week, prioritize, like list of which one is the most important to you,
Okay.
and we'll go
Okay.
from there.
All right.
So is there any?
Sound pretty good, that relaxation technique.
Yes.
Yes.
So is there anything else that we can discuss, or anything else you want to share while you're in the session with me today?
Well, I got one other thing that the doctor, when I want to see the doctor so I can talk to him about adjusting my medication.
Well, we'll see the doctor next Friday
Okay.
when you come in. So you're going to see me next Friday at the same time at 2:30.
Okay.
And then by that time, I'll talk to the psychiatrist and the psychologist and the supervisor and let them know to see how we can better help you.
Okay, let me get this straight now. I'm going to see the doctor.
Mm-hmm.
You're going to help me get my medication straight. And I got to go ahead and write my little chart down when I feel distressed. Write it down. And I'm going to listen to some music for a relaxation technique.
Yes. Now let's go back to you buying Xanax. So you can't. I mean, I prefer that you don't do that because that is
Oh,
against
that
the
was just.
policy.
I don't want to do that. I don't want to do that. That thing was. I think it was just too strong. That's when I want to see the doctor.
Because I feel like maybe but because we've developed a good rapport and a good relationship, therapeutic
Right.
relationship.
Right.
I don't want to put you on a contract. So right
Right.
now we're going to see how things go. When you
Right.
come back next week, you're going to get another urine screen to make
Right.
sure that you're doing what you're supposed to do.
Okay.
Okay?
That sounds pretty good, Michelle,
Okay.
because you've been a nice person, and I just want to continue having you in the service that I receive at this clinic.
Okay.
Good, and you guys have been good for me. I
All
want to
right.
thank you so much.
And thank you, Mr. Jones, and have a good day.
Thank you, Michelle.